Nice to see you. For people whose camera is off, you're listening. This is Eileen's. This is Eileen.
And I have started the recording, Eileen, so whenever you're ready, the agenda is in the chat.
Okay, thank you. Hi everybody, let's get started. And I felt like last time when we got to meet a month ago and we did our brief, sometimes they're more brief than others, our sort of like icebreaker type thingy. It was one that we had repeated before. And of course, because I love the isotopes and United, I was planning to ask about that. But I thought that instead this time I'll ask people to say something that they're looking forward to right now. And maybe I'll call you as we go along, and just something that you're looking forward to. And some other things are that let's all refer to everybody by their first names. I welcome you to add your pronouns, and also that everybody's here because they belong here, and silence means agreement. So our silence is active, which I do recognize that historically when I've said that, I have been the person who's been the hardest time adhering to that one. But so going in the order in which I can see people, Gary.
Well, I am looking forward to going to Denver next week for the Psilocybin Conference 2025. Yes, it will be very, very interesting. I stole that from Dominic, but he'll be there as well. So yeah, I think this is really quite an event since, post-COVID era. And it will be a very interesting opportunity to learn quite a bit about what's going on in other states, but not only just about psilocybin, but other substances as well. So if you are intrigued by what's going on in Denver, it's MAPS 2025 or Psychedelic Science 2025. You'll see the conference there in the agenda, but that's something I'm looking forward to. But since I'm got the mic, Mateo and Haley did both mention that they would not be making today. So again, they did let us know that, so we won't expect them. And when I'm done, I'm going to reach out to Dr. Gill. I'll go ahead and mention that Dr. Gill was appointed by the secretary and typically has this time frame available. So I'll reach out.
Thank you. I was just scrolling thinking like, but so thanks. And Hallie.
I'm looking forward tomorrow night to flying to Iceland and spending 10 days on a tour. And I appreciate everybody's willingness to meet today instead of tomorrow, so I could participate in this as well. And that's about it, I think.
That's pretty great. Dominic, how about you?
Good afternoon, everybody. So Dominic, and something I'm looking forward to, and yes, Gary did steal one of them with that conference next week. It should be very good. So I think for that, I'm just going to go ahead and make sure that I get to ask Gary a question that I know he can't answer during that conference. No, I really will not do that. But in addition to that, though, I will say that I am actually very much looking forward to a little later this summer because, as you all know already, I think that I'm a huge gardener. And with my change in abode this last year, my garden has been very delayed. But 2 weeks ago, my greenhouse finally got up. And so now I am building tables so that I can actually start putting and moving plants in and start my garden, my greenhouse garden. So.
And a very busy person, and yet still able to have bandwidth to put together what might be a suspender bow tie look, which is a very good look. Very, very good look.
Thank you. That is actually all due to my other half. So.
Okay, well, my compliments to them. Kathy, how about you?
Good. I thought you were saying Katie. I'm like, sorry, it's Katie. Sorry, Kathy.
That's okay. I am looking forward to finding out where my daughter is going to land for her practicum year for her social work. Yeah, she's been applying for different places, and I'm just anxious to find out where she'll wind up.
Okay, well, we all wish her the best, and that it's someplace that she wants to be, and that hopefully that aligns with where you want her to be. And how about Katie? We'd love to hear from you.
I'm looking forward to visiting my daughter and son-in-law on the Oregon coast next week, and cold water surfing for the first time.
Nice.
Ooh, that sounds fun.
Yeah. Alan, how about you?
Alan here at Deming. We finally got our winds to settle down and our dust bowl to clear out. So we're just looking for a nice, clear, warm summer. Nothing in the plans at this point that are worthy of mentioning. So we're just cruising through the summer.
Cruising through the summer. That sounds like that should be the song of summer. So we'll be waiting for you to come out with that, whether it is with an electric guitar, a banjo, semaphore, whatever it is. We're going to be ready. Rosalie, how about you?
Hi, good afternoon, everyone. Rosalie here, and I think that I'm looking forward to. I have two new great nieces and nephews that are due to arrive in August. So we're really looking forward to having them join our family.
Oh, best wishes for safe arrivals. All safe arrivals. Yeah. Eleni?
Hello, everyone. I'm Eleni. I'm sure nowhere near as skilled a gardener as Dominic, but I'm also looking forward to vegetables. We have little green tomatoes and like some zucchini blossoms in the garden already, so I'm really excited about that.
Nice. Brenda.
Good afternoon, everyone. Brenda Martinez here. I'm looking forward to a few days off next week. So getting some retail therapy in and just not being connected to phones and screens. So
Nice. What kind of retail therapy?
we're heading into Castle Rock, Colorado. So I'll be just down the street from Dominic and Gary, but I won't be working or attending a conference. I'll be eating lots of food and spending lots of money on things that I really don't need.
Okay. No judgment there. Enjoy all the food.
Yeah.
Yeah. And Karina, great to see you. Welcome to the call. We're glad to have you. We had opened with that everybody's here because they belong here, that our silence is active. So it means that silence means agreement. Also that we're going to refer to everybody by their first names because not everybody here, we have different terminal degrees and everybody is welcome. And the prompt was to ask people to say something that they're looking forward to.
Yeah, my name is Sabrina. I don't know how to change it at years. They do this at work so that people know that I'm a doctor. It wasn't my idea. And sorry, you said things
something you're looking forward to.
Oh. I'm so sorry. I'm looking forward to when I finally have some time to read. Sometime.
All right. Thank you. Thanks. And way to be put on the spot and to deliver. Thank you. And even if it was your idea to keep Dr. Gill, that's fine too. Yeah, it's fine. And yeah, Adrian, how about you?
Hi, good afternoon. My name is Adrian, and something I'm looking forward to is my daughter's birthday tomorrow. And then if you're from near the Mora, New Mexico area, the infamous raspberry farm has finally reopened. So even though unfortunately you can't pick the raspberries, you can at least enjoy the little treats like brisket and swirl raspberry ice cream.
Excellent. Good things to be looking forward to. Thanks everybody for going with it. Of course, we've been doing it this way for people who've been in the committee for a while, where we do a bit of an icebreaker because it can be a bit of community building. It can also just introduce that we're all people more than we are. We have a richer, fuller identity that is broader than just our names and our titles. And sometimes we come up with entertaining things and also great ideas for each other, but also I think it just helps us round out our humanity. So I appreciate you going with it. And with that, we'll move forward to the next item on the, and then also because in the coaching literature, that when we talk about something we're looking forward to, it helps increase our in general, our flexibility and our mental flexibility and our, and I think that that's always a really good thing to have. And so with that then, Gary, I'll mute myself and turn it back over to you for item 2 on our agenda, the update.
Okay, great, thank you. So again, for the update to start, the first agenda item was new committee members, and Dr. Gail Sabrina, welcome aboard. We did get the appointment letter completed and signed, and so we are just so pleased to have you here on the committee. Adrian, I'm not sure, were you at the last meeting, Adrian? I'm not sure if you got the opportunity to really introduce yourself and your new role. Am I mistaken?
You're correct, Dr. French. I apologize about that. My name is Adrian Estrada, and I am used to be an eligibility interviewer with the medical cannabis program, and now I'm a health educator, which I am thrilled about because I have years of experience in frontline customer service, retail, government support positions, etc. So I really have a unique perspective and definitely something to bring to the table for the medical cannabis program and soon psilocybin.
Yeah. Great. Thank you, Adrian, for that introduction. And so committee members, just so you understand, and Carmen is not here. She's typically not here on Wednesdays, but again, you have a full complement of health educators. Diego's not here as well. So Diego, Carmen, Katie, Adrian are all our health educators, and then Rosalie is their leader. So we got quite a complement, quite a great team, and hopefully we'll collaborate more and you'll get to know them more. So that being said, one item I did want to bring up, I had this in my notes, but I didn't quite have the detail, is I think we were talking about perhaps having a preventive medicine resident be on the committee. And I think that Hallie, you were one that sort of had brought that to the forefront. I didn't have any more details than that. So I'm just wondering if we had an update or a contact to take it to the next level.
Yeah, so I have not been in touch with the leadership of the preventive medicine residency, but I know them, and I've been part of the residency since it was established, I don't know, 10 or 12 years ago. So it's just something I didn't get to, and I apologize. I imagine that they would be very interested in this, but I'll need to be in touch. Now, Dr. Kessler is the chair of that program, and I can get you her contact information offline, Gary.
Yeah, I think that would be great. I think that sometimes if we just put that out there, we will probably get some interest, especially with the psilocybin as well. And that could be a great resource, those residents. So yeah, just when you have the chance, when you get back into town, look forward to it.
Sure.
And that was Dr. Kessler. Okay. So again, the next point here would be to talk about the results of the survey. And I do want to thank you all. Oh, I'm sorry, Elaine.
I wish I had thought of this ahead of time. And Hallie, thanks so much for that wonderful suggestion. Gary, for following up. If that doesn't work out, I wonder also about the role of reaching out to the Addiction Medicine Fellowship. Because I think that there could be, because fellows often have also a little bit more schedule flexibility than the residents do. But that I bet that this is so right up the alley for preventive medicine. And I think also it could be a rich, it could be a wonderful bidirectional, multi-directional relationship to consider the benefits that could result from having the addiction fellows, to have one of them. Just a thought, and if we decide that we want to do that, depending on what we find out from the preventive medicine fellows, just maybe let me know and I can reach out.
I'm going to digress here for a second. Rosalie, you've not had the opportunity to introduce yourself to the Public Health and Safety Advisory Committee, have you? You may have not been here for the last meeting, so I want to apologize by not, giving you that platform.
Oh, no, this is actually my first meeting, so it's a pleasure to be here. I've seen the recording, so I feel that you all are a little familiar. I know who likes the red or the green chili. But anyways, yes, so my name is Rosalie Nava, and I am joining the team with a background in social work and in public health. So I'm really glad to be part of this team.
Well, thank you. And sorry, Rosalie, but thank you again. So yeah, and Rosalie was the point person that helped me put together the questionnaire. So again, thank you, Rosalie. She directed me to Microsoft Forms, which is what we used, and actually worked quite well. I did want to share with you the results of that survey. I went ahead and compiled them because there were a lot of recommendations that were on everyone's list. I call those the tier 1 recommendations. And then there were some that were on a couple of people's questionnaire lists, and I put those down in tier 2. After doing that, when I looked at the list again, I was surprised to see that nearly each one of our 8 sections was represented. So again, but again, I think this does hone down what the board the committee could address. So I'm just going to share my screen. And is it coming through?
Yes.
All right.
Yes.
So again, when we talk about these recommendations, these are sort of what there was the discussion and then sort of the recommendation at the end, the salient point that we wanted the legislators to understand. And so these are the ones that definitely registered on everyone's responses. And number 1 was a dedicated epidemiologist. And I know that that's something that we have always wanted in the center. And I think that with the addition of the psilocybin, that will hopefully be something in the near future. But of course, I can't attest to that. But I do know that is, that would be quite nice, especially to process all the information that we're going to be harvesting or learning from the surveys that we do with cannabis users, but also psilocybin users as well. Another important one was to strengthen packaging and labeling, and specifically reduce appeal to children and adolescents, but also really increase the warnings for pregnant women. So again, whoever would like to tackle that recommendation, those are the 2 points or subsets that really came through, was those 3 groups. And again, that correlates to section 6, which is educational needs for children and adults. The section 4, that would really be the percentage of emergency room visits and outcomes. So the correlations were there. Lockbox initiatives addressing both funding and education. And again, that really goes to child access. So again, that was the 3rd most prevalent. This was important: develop, implement, and evaluate educational programs, but also increase the resources to do that. We can talk about development and implementation, but sometimes we need the legislator to help with those resources. It's very difficult to demand money. Again, put a price tag in there. That might be something we want to stay away with when making the recommendations, but I think using the term resources might not be a problem. They might ask for an amount, but again, the who is this for? Kids in schools, pregnant individuals, older adults, tribes, public health equity issues, and then the dispensaries. And I do want to state that we are reaching out to the dispensaries, the health educators, the health education team, and they continue to educate those workers at the dispensaries and I help message as well, help them with messaging when they do interact with patients. And then what are the educational goals? Educate with regards to driving under the influence, adverse effects of cannabis, of course, discuss exposure to kids and the pregnant patient individual, and then also firearms use, especially conceal and carry. And interestingly, one of our, I believe it was Diego, is going to create a handout specifically targeted to that firearm issue. So that's another addition that we're going to put on the Cannabis Learning Lounge, is that handout. And he's working on that. But again, the firearms, I don't think we really brought that into the last report much at all. But, and again, all of these might not get addressed this year, but this is where people's interests are. And that would go along with educational needs for children and adults, of course. So that definitely fits in well with section 5. And this was also very, very, it was always like 3rd on all the questionnaires. It could actually probably be a little bit higher, but create a comprehensive dashboard for monitoring cannabis-related health outcomes related to cannabis consumption and improved data collection. Essentially, that sort of goes to the Section 7, the Poison Control Center. I think that sort of is where that was highlighted last year. But again, this dashboard to maintain this information, perhaps not just from poison control, perhaps from ER as well. But somewhere a vault where this information can be and accessed. Tier 2 responses. So these were on, a few of the questionnaires, but definitely more than just one. One was determine impairment, but I thought this was a great suggestion. Include other states in this dialogue. I think that this is not unique to our state, the issue of impairment. Other states are having novel approaches to it. And that definitely ties in, of course, with road safety and driving while impaired. Increased inspectors to improve regulatory compliance. That goes along with workplace safety. But again, that was something that was mentioned. Expand treatment options for opioids, alcohol, nicotine. And again, that ties quite nicely into Section 8. And then regulation of hemp-derived products, high-potency products, and synthetic cannabinoids. That definitely goes in with consumer and product safety. I know that there was a wonderful Delta 8 section that Eleni wrote last time. And I think high-potency products were also addressed. And I think actually the synthetic cannabinoids might also have been discussed here with the hemp-derived products. But I think that ties in well with some of the regulations that we saw, or some of the laws that were submitted. They didn't necessarily pass, but again, the legislature, I think it's on their dashboard. And this continues to be such an issue. We attended. There's a roundtable of attorney generals from many of the states, and it was rather fascinating the problems that they have with these hemp-derived products because they're completely unregulated. So they can mimic food products. They're unregulated. The colors, what's in them, they're unregulated, and it's also creating this discordance with the regulated cannabis industry. They're now at a disadvantage for marketing, et cetera, when you compare them to some of these Delta 8 products. So I do think that that's going to, enter the zeitgeist here more and more as time goes on. There were some other recommendations that were made, but they really weren't quite ones that I think found a place in the report. I think they were less for maybe our legislators, and I think the audience for these recommendations were really the committee itself, how to improve the committee experience. And so I'll just share those. One was addressing the qualifying conditions and improved medical indications are based on evidence-based research. And again, I think that I definitely hear that recommendation. Again, I think that might be more the purview of the Medical Cannabis Advisory Board. Again, that's what they're set up to be doing. And that's sort of through the petition process, how they should be approaching each one of those. But I think that, the reality is that a petition can be submitted showing why a condition might need to be removed. And I think that's perhaps how this gets addressed, is that through the new science and evidence-based research is submitting a petition about why perhaps a condition does not meet muster or maybe shouldn't continue to be there. And I know that actually sleep apnea was one that gets more quixotic nowadays. So, but that's how we would accomplish that recommendation. I thought this was great. Additional stakeholders to attend meetings and inform us. And again, we did talk about this a little bit about having a legislator come. We don't have one today. Industry individuals, RLD and DPS. I'll talk a little bit more about RLD later because they had their CRAC meeting today, the same day that we had our meeting here. So I was listening to it up until we started this meeting here. And though I outreached last time, I do think that we're going to be able to get one of their individuals here to come and share with us some of that side of things, that industry side. I have some of the data from their presentation I'm going to share later when we get to that point. But yeah, stakeholders, DPS, to talk to us about the road safety. I think we need to continue to cultivate that to make these meetings less more exciting, more interesting, and then take that energy and then put it into the writing. So I think we can work on that. This is good with stronger media distribution. We talked about this, perhaps an op-ed to stakeholders who can take action. So again, I don't have a response today. I have not heard from the legislators with regards to how they feel about the report. I don't have an update there, but perhaps through either a meeting invite or somebody getting their op-ed out there, we can get some more attention to this wonderful document that was created. This one I just quoted because again, I think it was just easier to quote it than to try to summarize it, but ensure policy resource development and educational programs include tribal consultation under the State Tribal Collaboration Act, Section 3, in order to provide appropriate development and implementation of policies, agreements, and programs related to cannabis, which may affect American Indians and Alaska Natives. So again, I don't think that I think the committee, I'm not sure that was fluid throughout the development of the report. I think it was always a consideration, the health equity piece. But again, I think making more of that effort and that extension going forward as we do develop that. I don't think we necessarily had a section of the report that really dealt with tribal communities. So that might be something to enhance this next time around. For those that responded, working on a team, it was what everyone preferred, and I think that that speaks to the members here that, everyone does like to work as a team and with the others. And then lastly, but not least, the dispensary tour would be July 9th was the hands down favorite there. And again, we're looking at a starting time of about 3 p.m. And that brings me to the next agenda item. Well, again, I think what I'll do is I'm going to send these out to you all, this document right here, and then you can look more at what those results were to see how that might segue into your section. And Eileen, this is where I just want to maybe ask your take on this. Certain individuals were more attuned to certain sections, and I'm not sure if we want, if you would want to assign that or still keep it, more as a whole committee approaching these things. So I can definitely share with you who has had more affinity for which sections and what have you, and we can do that, afterward. But just I'll plant that seed. But back to the dispensary tour. July 9th is a Wednesday. It is a Wednesday. Second one in July there. And we were thinking of sort of starting at about 3 p.m. The reason for that is to get down to the dispensary. This would be in Santa Fe. The goal would be to meet here at the Reynolds building. And that way you would have a chance to meet, at least know where the office is, meet some of the staff here quickly, and then we would go to the dispensary. We're looking into getting vehicles. And if we don't have a state vehicle, then I have a large one to go to the dispensary. We do have the dispensary is aware of our coming, and probably spend an hour to an hour and a half there, or shorter if people are satisfied, and then come back and then hold the next meeting afterward here in a conference room. That would again give us the opportunity to be in person. For those that can't attend, we would bring in a meeting connection through the web. Again, the W-9 that was sent out, you are eligible to be compensated for this travel, but we do need that W-9 form. I can resend it if you don't have that, but the timeline to process those is very, we need a bit of time. So we would have to rush any of those if you have them, but we definitely would like to try to get those processed in case we want to do a meeting in person another time. So is that working for everybody? That's sort of the feedback put together. That would be a Santa Fe, 3 p.m. and then a meeting afterward. Is that still working for everyone? Okay, great. And again, what's really nice is that our new health education team, a lot of those members will be joining us as well. So we'll be committee members and some of the new team members. And so I think it'll be a great event. I talked about the W9s. So again, for those of you, if you aren't able to make it this time around, we'll try to program another tour in the future if need be. So I did want to talk a little bit about the CRAC, that's the Cannabis Regulatory Advisory Committee. They did hold their meeting today as well. I listened to a bit of it before jumping onto this. And they sort of do things in reverse. They have public comment first, and then they were getting into their nuts and bolts as I had to depart. But I thought it was really interesting just to share with you some of the themes that they're dealing with. These were public comments that were left. And this is, again, I'm not sure how this might tie into our vision, but again, enforcement against outside products. That was what a lot of the public comments were about. Consumption zones, because some of those look like they're going to be coming on tap here pretty soon. Uniform testing of product, getting rid of the plant counts. This is odd, extending expiration date for products. Can't say I would be in league with that, but that was one of the recommendation or the public comments that was made. And then unlimited THC and topicals. So again, that's sort of what they're dealing with over there in the CRC. But one very interesting thing, and this goes along with one of the recommendations here actually, was that they are going to have increased regulatory powers. They will not only just be administrative, but they will have a law enforcement component. They were talking about this a bit, and they will be certified peace officers. Now, they're not going to be any of the current regulators right now. They will stay administrative. They're going to get people that are trained to be certified peace officers for that law enforcement arm. And this is going to greatly enhance their ability to not so much police the good actors, but really root out the bad actors. And so that is, I think, would be probably one of the most pressing themes of the meeting that they had there today. They talked about this quite a bit. And of course, they were given these regulatory powers back during the legislative session. So I think that that really ties in nicely with that recommendation that was made about increased regulation and enforcement. And then I thought these were some interesting statistics that I wanted to go ahead and share. Since April 1st of 2022, does anybody have a guess how many dollars in sales, and this is both medical and recreational, or recreational, do you think the state has been sold in the state? 1.7 billion is what they believe the state has made, has been made in sales in the state. About a third are medicinal, medical, and about the other 2/3 are recreational. 510 million medical, and then 1.2 billion in rec. So again, that is what their numbers show. I did think it was interesting that they also did share that they put a little asterisk there. Please remember, a lot of people that purchase recreationally are likely using medicinal as well. To not assume. I thought that was interesting. They shared it that way, but I do think there's some truthfulness in that. And that was really, when I had to depart. But again, I think that attending the CRAC meeting, a representative will be more than. And actually, they did talk about perhaps collaborating with, more so with the Department of Health, the Center for Medical Cannabis, but I don't see why one of our committee members couldn't be there as well. So we'll look forward to that in the future. And then with regards to additional committee members, again, I think we talked about that earlier, perhaps the preventive medicine residents, and then perhaps also the addiction fellows. Could be additional committee members here. I do know that Rosalie is going to reach out perhaps to more of a occupational therapy, health and then environmental safety, and then road safety as well. So we're trying to cultivate that side of our committee membership, because I definitely know that we have the medical specialty here, but getting some of that road safety, occupational safety, environmental safety as well will be nice. So that is the update for today. Eileen, I'll turn it back to you for next steps and just with regards to, how we want to take this information and use it.
That was a ton of information. I have a lot of thoughts. I also want to see if others do. I feel like at times I kind of over contribute to this meeting. So I am going to pause to see what questions or reflections do people have for Gary, because it was a lot that was in there. And maybe actually I'll pause myself too.
Could put it in the chat, but I think it would just blow the chat up. So I think I'll just compose an email real quick and put these in an email for each of you so you can look at what these results are. And then we can, of course, continue the conversation.
Thank you. Howie.
Well, there was a lot in, especially the first part where you went through the priorities and some of the other items. And I'm wondering if we could go back to those, if not today, maybe next time, to really discuss them to see where we are. For example, one of the items is how do we, if no legislator has been in touch, for example, with you, Gary, or with Dominic or others from the DOH, then did anybody actually read this report, and are we really doing anything of value here other than fulfilling a legislative requirement? And I personally would like to know, because, if I used to run a consulting firm, and when reports sat on shelves, nothing happened. And I sort of wondered, what am I doing? Which is why I got a consulting business. And so that's one question. The other question I'd ask, which is a really just technical question, and I apologize for my grand dog barking in the background if anybody can hear him, is of the 3 billion that's come in, or 1.6 billion, I can't remember the exact number, in revenues, does that include taxes, or is that before taxes for the recreational side of things? I guess on the medicinal side, there would be no taxes, of course.
I don't know if that included taxes or not. The medical is not taxed, so of course it wouldn't be there.
Right. I think you said 1.1 or 1.3.
I'll save it for their minutes. I think they will have their minutes, and I can look at it then, or reach out to Todd and find out exactly what he was referring to. I do think that that distinction I'll be able to make at a later time. With regards to the legislators, this is again one reason why I'm excited for Denver, is that will be an opportunity to actually rub shoulders with a couple of them. And I do hope that in that interaction I can have at least their interpretation, or their sharing of what they thought of the report. So, and Dominic, I'm not sure if you've heard from others. Oh, Dominic's hand is up.
Yeah, and just sort of to go with that is nobody's reporting back anything officially on it as far as having read it, but I have talked with a couple of the legislators who actually have, even if they haven't read through the entire thing, they have perused it, because at the Roundhouse they did actually talk about certain aspects with regard to other bills. And some of it we, of course, sort of prodded a little, because we did use some of the information, as we were talking with RLD as well for the bills that they had, and help provide them with it. And I know they provided some of that as well to some of the various legislators. So, at least some of them have actually read it, and at least have read parts of it, and they did utilize it during the session. To exactly what extent, we don't really know, because they don't really do a survey of the legislators. So it's not like we, from that standpoint, so we can't really say how many of the legislators have actually read the report. But I can say that information out of it was utilized during the session. I saw it actually happening with my own eyes. And so we do know that that it has had an impact. I can say that. What that the impact level is, that I can't really say. But as Gary also said, we're going to see a couple of the legislators up in Denver. In fact, I'm serving on a panel with Senator Steinborn, and one of the things I actually want to ask him directly is, what did you think of the report for from medical cannabis? So, hopefully I'll have that answer for you all next time.
I will say that I sent the report. I'm a constituent of the majority leader of both the House and Senate, so Peter Worth and Rena Shapansky. So I sent them the report and said, "Are you aware of this?" And I got a call from Peter saying, "When can we have a meet?" Not from him, but his secretary. "When can we have a meeting?" And she gave me a few dates. I have not set that up yet, but because it just came back. But I might suggest others do that just to raise awareness that this exists at this point.
And upon that meeting, would they want to, Hallie, visit this meeting and perhaps share what they thought was most important, what they found useful, highlight what they thought was great, or what was deficient?
Yeah, well, I can ask them that for sure. And I was going to call you and Eileen to see if you wanted to join me in that meeting, actually. But I obviously haven't set it up yet because I haven't been able to coordinate any times with the three of us to see when that might happen. But sure,
Absolutely.
that would, yeah.
I'd love to be part of that. And Eileen, yeah. So, well, yeah. So again, that goes to getting other stakeholders and really using the media to get the word out there about the report. Should have just sent it to you all, that summary, and so feel free to open that up, and then that might help our discussion here a little easier, make it a little easier.
Thanks. And team, I'm being a little bit tactical also, building upon that, we often go between what's tactical versus strategic versus sort of cognitive. And one of the very natural things that can come up after you're asked about what do you really want to do? Like what do you believe in should continue in the report, right? And in our next version of the report, and also what area are you most passionate about? And I know that people here really cultivated or built upon their existing expertise and to contribute to that report. And among the reflections, if I may say, that I saw about what you had indicated, Gary, and were our survey findings, is that we didn't see that the document really needs to have meaningful changes. There will be some changes, but we didn't see that it was like, oh my God, we have completely different recommendations that are going to be coming. We need to do another massive lift. Like, oh, we missed the boat last time. There was nothing like that. What I saw was that there was a lot of support for continuing the direction that we had gone in, and then also some ways to think about scaling the work or interacting in other dimensions. With that in mind, I think that Gary, does it sound like reasonable to consider like level setting about what could be a timeline for some next steps in addition to the follow-up? Oh, thank you. Okay. And I have some suggestions there. This is unfair for me to like drop this on you, Gary. The idea is like, I should never be surprising you, Gary. Sorry. Surprises are great on our birthday. Otherwise, we try not to surprise. And it's like never surprise the chair and try never surprise the staff. So here I am surprising the staff. But Dominic, before I present that, before I present this, or actually I'll put that into the chat right now for people to take a quick look. And Dominic, I'd love to hear from you.
Yeah, I actually have one piece that we don't have the report yet, but it's something that we will have by the time the next meeting occurs. For the dispensary tour and the next meeting is our annual survey that we do with the patients, and we got a good preview today, we met with the team that's doing the survey, and there's actually some very interesting pieces in there about education between patients and providers. And so I think that actually will be a piece to maybe also look at to say, are there some areas that maybe we need to look at refining or suggesting some other recommendations? And so we'll have that report. They're going to be getting that to us by the end of June. We've seen some very preliminary and rough data, so I don't want to share it just yet because it's not the final and they have to clean up and do all of that. But as soon as we do, we will share it with all of you, so that way you'll get to see it pretty quick. But they only the great part about the folks that we have doing this is they do this every spring, and now they've been doing it for several years, so we actually can see trends over the last few years with some of the data. And so I think that'll be very helpful in doing this report, this next year's report. So I just wanted to let you all know about that.
It's going to be exciting to see. Thank you. Hallie.
So I think I agree with you, Eileen, in your general view that there aren't major things that we probably have missed. I guess what I would ask is, are we going to be able to update the graphs and tables with one more year? And so your comment then would be appropriate if there's no major change in those trends. If there is a major change in the trends, then maybe we need to revisit the question of what else can we or should we be recommending or doing in order to address changes in public health policy in that regard.
Yeah, thanks, Mandu. I wish I had a dedicated epidemiologist. Just gonna put that out there.
Right. Well,
I wish I had a dashboard.
will Haley be helping us in getting those additional data, or however we got them last year, whoever this sponsors
was integral in obtaining that, and I do believe she will be helping us with that as well. She's a very dedicated helper. And the caveat here is she just wasn't here today. I do think the data that would not change would be probably the BRFIS and the YRSS, because just the frequency that those questions are asked. I don't think that data necessarily will be available. The ER room visits and the poison control, I do believe she'll be able to obtain that updated information. So those are sections which, could change numerically, but almost theme-wise, I'm not so sure the recommendation does change for those groups. I think the recommendation is let's get a dashboard and let's get an epidemiologist, one, and then two, how does that segue into the education for those groups? But she's definitely been included on the invite for the dispensary and so forth, and I'll again see if she can be at the next meeting, but she would be our point person at this time to help get that data. And when she gets it, it'll be in the SharePoint site, much like it was last time.
Thank you. Important question. What other questions do we have, team?
Do you know if there will be new PRAMS data regarding the sort of the best surrogate we had for use during pregnancy?
I do not know at this time. That would be a Haley question. But I will ask it and then try to disseminate that, or at least have it ready for us for the next meeting.
Yeah, thanks. And with that, I feel like in general, probably, I think, Gary, that you really, and Eleni, that was a wonderful and such an important question. Thank you. And that, Gary, that it sounds as though when we have our teams that we'll be able to say, this is the data we are able to update, and I think that we'll know more. What I want to reflect on is if people would look in the chat at what I had added for a suggested. I recognize that this is very softly worded. That was very intentional because, again, I'm surprising all of you with it, including Gary, and never surprise the staff. Suggested possible timeline for next steps. And you'll see that it's what will be by the end of this month is ensuring all the 8 domains that we have to for the purpose of the way what the legislature told us to report on, that everything has coverage, but then also we try as much to align the people's preferences with what are their needs, and having that at least ready to go. And then in July, that the teams will be able to meet and review their existing, their like section or their domain, and to make recommendations on the background, but also if there's any changes to the revision on the existing, like the overarching recommendation or the summary language. And then in August, that people by the end of the month will submit their first draft. September will be a lot of finalizing work, and then the first week of October to submit. I'm assuming that the timeline for the first week of October is going to be similar from last year. And if not, it's also, as long as we're not late, it's okay if we're a little bit early. So I'll pause there first to see, colleagues, does this, I guess I should, the most important thing is my thinking for the deadline by which we submit. Is that, Gary, what you were thinking as well for the first week of October, that our final be submitted? Or
just looking at last year's outline, and Kathy, thanks again. And what we'll do is we'll probably update a lot of this into that framework from last year, but that mirrors is quite a bit the timeline that we did have for last year. I think that worked well. The one caveat is we did try to stagger the submission of a lot of this information to make it easier on the editors. I'm not so sure it's going to be necessary this time, because you know, the bulk of the information sort of is there, and it's more just the update. So I don't see why we might necessarily have to stagger it like that. It might have made it a little bit confusing last time. The word editor came out of my mouth. I think I know what Hallie's question is.
I was not going in that direction, but go ahead, continue.
Oh, no, I know that we had talked about, you know, do we have the ability to have outside editors and the like? And again, this would be something that we do internally here with our chair and co-chair.
So my question was more related to the 30-day, 60-day question of the state legislature, and if that in any way, and it may not, which is fine, you can just say that, if that in any way should color the way we want to write this report, if it makes any difference in the way legislators might think about the report or even review it or ignore it or whatever. I'm just wondering if that has any impact.
I can't speak for anybody in the legislature, of course. I do think that is an interesting question to pose, because again, in the 30-day sessions, that's going to be more budgetary in what's addressed. I think that having it annually creates a cadence to where they're expecting something and they'll read it. Will it translate into legislation each year? Probably not. That would probably be something every other year. But again, the seed gets planted during these sessions. So I wouldn't change a thing. And again, if we have a plethora of new information, we don't want to hold it back just to submit it a year late and then have it be late data. I think we sort of approach it the same each year. Dominic, you might have a better understanding of that.
Yeah, I think what you're really asking is, because it's going to be a 30-day budget session, are they even going to look at it? And I can't really answer that one. But what I can say is kind of what Gary, along with what Gary is saying, if we're doing this every year, what happens is in a few years, we're going to be able to pull together a report that actually shows the trends over multiple years in these different categories. And so I think that in and of itself is and it makes it an easier lift to do it each year rather than every couple of years. And so I think that is an important aspect of it, not just to look at what are they going to do this session, but what can we do with it over several years rather than just looking at the one, if that makes sense.
Yeah, and that's part of what I was trying to get at. But I guess part of my question is there something we ought to be doing to make it more attractive for them to look at in different ways. We don't need to answer this now. We might just think about it. Maybe there is nothing. Maybe you're exactly right. We just continue to provide the same data. Maybe we have access to new data or different types of data. I don't know. But in any event, I'm just thinking about once when I was on a board where we were having trouble getting the school system. This was in Hartford, and we had a huge unwanted pregnancy. The pregnancy rate of teens was twice the national average. And the question was, how do we get that down? And one of the questions we asked was, how do we make this more attractive to the school system so that they would consider doing more health education and pregnancy prevention in the schools in different ways? And once we started doing that, and we actually got the superintendent interested, not because of the pregnancy rate, but because of the STD rate. And by doing that, we were able to get him to focus also on the pregnancy rate. That's all I meant. So I'm just wondering, as an analogy, if there, and maybe it's too early, maybe we don't understand enough of how the legislators are thinking, or there are lots of other, options here. So I'm not precluding anything, and you may be 100% right, Dominic. I'm just sort of raising it as a potential question.
Sure. It's, oh, I'm sorry, Eileen. My apologies.
Oh, you're so gracious. I would love to hear what you say, and then I'll make a brief comment that is a brief comment.
Well, what I was going to just say is, we've been told time and time again that the best way for us to actually get people to engage with us would be to provide free samples. And obviously we can't do that. But what we can do, and this is something to think of. So Rosalie, if you'll put a pin in this, every year at the Roundhouse, they do a public health day, and we always have a table there. What I would also suggest is if one of you as a member of the board of the committee want to be there, then you can also be there to help talk about this, because we do that sort of thing. So just, have a little bit of humor, but also a positive suggestion.
I love a positive suggestion, and I think that one of the things that's really tough right now is that the news cycle is not on our side. Right now, I think that the state is spending, the state and the state employees, I'm guessing, and just like most people are trying to put out a lot of fires right now, and so it's hard to have something that doesn't. Like if you think about in your Eisenhower matrix about urgency and importance, there's so many things that are urgent and important right now that it's hard to shift our focus to things that are important but not as urgent. Like when the building isn't on fire, it's hard to pay attention to like the thing that's sort of smoldering along, or when the matches are way over there and the wood is over there, something like that. So I think that there's just a lot of challenges, and that I love the idea of repetition. I think your idea about, oh my goodness, that's a wonderful idea about Public Health Day. I think, again, all of us, I hope everybody here will continue following Hallie's lead with reaching out to their elected leader, and then also they themselves writing op-eds or letters, or making just quick phone calls, easy peasy. Tagging on social media. Everybody who's elected loves to be tagged on social media. As long as it's like, be vaguely positive and grateful, right? There's ways to be more effective. It's interesting. People may know that the movement that was called This Is Our Lane, which led to the increase in the CDC funding about firearms violence, was started by an article. I used to be the chair of the board of the organization, the American College of Physicians. It was our flagship journal called the Annals of Internal Medicine. And particularly, we had one that was about firearms violence. And the NRA had tweeted criticizing us, saying self-important doctors should just stay in their lane and not be talking about guns. And so that took off and turned into the movement that was called This Is Our Lane. And then it downstream led to the increase in funding for the CDC related to this. And I say that to say that that was like, that like is, lightning really strikes the same place twice, right? But what it means is that there can be a really powerful role of individuals in social media. So that's something to consider, as long as we're not, we're in takedown culture right now. Like, don't take people down. This is about lifting people up and being collaborative. So thanks. Yeah. Anyway, I'm just scrolling to look onto the other page, see if there's any other hands raised. I don't see that others are raised. It seemed like that there was generally some broad support for the suggested possible timelines. So now this might graduate to a timeline for next steps. All right. And so it sounds like some next steps also are going to be that we'll sort through the survey responses, try to match people to groups. Thank you, Gary, for nodding. And then also include in those groups, maybe what were their data sources that were provided locally, that whether they can be updated or not. Does that sound okay? Wonderful. Yeah. And then, okay. Dominic, please. Are you going to say something?
No, I was just nodding my head.
Okay. Okay, great. Gary, anything else there?
Well, yeah, and I was sort of
what
creating
there?
a shadow right here. Determine the teams, update the updated data sources, determine updated data sources, but also determine the themes. So we've got these recommendations now, and I guess the team can determine if they want that to be their focus or not. And I just wanted to throw this in here too. I think one good thing from the document was we didn't see the duplication that we saw previously. I think that was a big concern, that we had a lot of duplication in the last document, but with these recommendations, they were all very, very distinct and dissimilar. So they could all, make their way into each one of those sections. But yeah, I guess after determining the teams, is that something that you want to collaborate on off meeting and then have it ready for the July 9th? Okay. Okay.
Yeah, it's only like 5
okay.
this, and I'm still talking when I'm muted. Come on, Eileen. Yeah, so if your timelines works out, that it would be wonderful. We could do that even before the July meeting, and just get that to people so that now that we've all worked with each other enough that we can connect and start the work.
Yeah, and again, we do have the data from the survey, but if after this meeting, there's, after seeing the recommendations, somebody wants to work on a different section or really hone in on something else, please just share that with me in an email, and so that Eileen and so it can be discussed. And I did want to inject this as well. I will get you all the directions to the Reynolds building. I should have shared that earlier. I will email those to you so that we are all meeting at the same place on July 9th. So that is yet to come. So don't worry about that. I'll get it to you.
Thank you. So with that, team, I think that we could probably go to scheduling our next meeting. We have a call with a lot of Globetrotters. I'm wondering if if I follow our having previously had a Thursday, previously a Wednesday, maybe I'll just put out that the second, or suggest the Thursday happens to be better for me, and if that doesn't work, that's okay. But to ask if July 10th at 3 o'clock works for people, and if so, if you would indicate with the thumbs up emoji.
Well, did you want to have the meeting after the tour?
Oh.
So we've already got the meeting scheduled, I guess. I guess that really could have been, we can project into perhaps late July, early August. Or do we want an intermediary meeting between now and July 9th?
Yeah, thanks. Oh my gosh, that's brilliant. I mean, I guess I was really thinking about would something earlier in July help us stay on track for by the end of July, having that the teams have met and have some existing recommendations that will then set them up for August for finalizing their first drafts or submitting a first draft. Or what are you thinking of that I'm not thinking of? Or we can actually, what did I just say? Yeah, let me just take your suggestion and say that how about the 24th at 3 the 23rd at 3 o'clock? July 23rd at 3 o'clock. And if you would thumbs up, thank you, Sabrina, for the thumbs up, for letting me know. Gary, that looks like that was sort of like a thumbs up.
Yeah. I think the 23rd makes sense. It's 2 weeks after we've met on the 9th.
Okay. Okay.
You're saying July 23rd?
July 23rd. Yeah.
Oh, sorry, I thought you were saying June. So let me.
Thanks.
Yeah,
And this is one case where I'd love that. Oh, thank you. Okay, Hallie, I'm glad that that works. It looks like Alan is back on camera. Alan, will that work for you? Eleni, does that work for you? Dominic? Wonderful. Okay, and then Adrian, Brenda, Rosalie, hopefully you get to join us next time too, and if not, that your colleagues will. Katie and Kathy? Okay, great. Then I think we're set for our next meeting, and I think we might be able to adjourn. All right. I thank everybody for your care of your community. There's a lot going on in the world. It's really hard for a lot of people right now. Thank you for taking care of yourselves. Thank you for taking care of your communities. Thank you for taking care of people you've never met. I know that you do that every day. All right. I hope you have the day that you deserve.
Thank you,
you.
Eileen.
Thanks, everybody.
Thank you, everybody.